Hello and welcome to our podcast. I'm Dani, and today we have not one, but we have two guests to talk to us today. We will talk with Charlie Gamble and with Patricia Peace. Charlie is the CEO, and Patricia works as a project officer in the Uganda project for Tackle. If you haven't heard of Tackle yet, they use the power and popularity of football to deliver HIV and sexual and reproductive health and rights, information and services to young people on football pitches across the continent. So please stay tuned, stay with us. This is going to be a really fun conversation. And I gotta say right away that I'm really interested on understanding more about this approach. I think it's something quite unique that we haven't covered on this podcast yet. So remember, if you're new here, press subscribe on YouTube or in your podcast app, and let's shoot it, shall we? Hi, Charlie. Hi, Patricia, and welcome.
Hi, Danny. Thanks for having us.
It's a
Hi, thank
pleasure.
you.
It's a
Thank you for
pleasure
hosting
to
us
have
here.
both. Yeah. Thank you so much for taking time and joining us today. Charlie, I'm going to start off asking you, as the CEO, I think I usually start podcasts with history, right? And you might be the one to guide me through here. So, what was the inspiration behind the creation of Tackle, and how do you connect football with health education?
It's quite a good story, I think. So more than 20 years ago, there was a group of people who were from the UK originally, but all teaching English in Tanzania. So long time ago, and in their own words, I think they've agreed many times that they realized they were terrible teachers, but they spent most of their time playing football with the young people they were supposed to be teaching. And they realized that it was the football they had in common, and football was a way for them to communicate with the young people in Tanzania. And if you go back 20 years, HIV was the single biggest concern for those young people in their lives, the biggest issue that they were facing growing up. So those volunteer teachers, they came back to the UK really motivated to try and do something using football as a way to tackle HIV in sub-Saharan Africa. It was just an idea at that point with no real formalized plans, but they were really committed to trying to do something. And they tried a few various things. They tried big tours of volunteer footballers who played matches against teams in Africa on like a big trip, and used the crowds for those matches to give out information from local HIV service providers and give out contraception. So they did that for a bit, which was quite good, but quite light touch in terms of actual engagement with people who were requiring more information. And it was a few years later where we as I was involved at this point now, decided that football coaches were probably a really good source of education and information for young people. So I was coaching football in Uganda. I was out there as a volunteer working for a street kids program, and also helping the Ugandan FA train coaches. And then it was quite a quick jump, really, once you see that, to think, actually, if these coaches talk about HIV on the pitch, outside, when you're having fun playing football, that's a great opportunity to talk about issues that these kids need to know about. The program we were working with at the time was doing HIV education, but it was doing it in a classroom on a chalkboard. And the peer educators who were really good at their jobs were struggling to get the information across, because it's quite complicated things you need to talk about. And the environment wasn't quite the right one for that particular group of young people who weren't really comfortable in classrooms. But they'd listened to everything that their coaches were saying. So it was quite a quick sort of assumption, well, if we can get those coaches to know that HIV information, then they can talk about it. Or if we can train those peer educators who already know about HIV to be football coaches, then they can do it as well. So quite quickly, you think, actually, we've got something you can scale here. We've got all the skills, we've got the coaches, we've got the peer educators, you've got the knowledge. All we're doing is, if we combine the two, let's make that information happen out on the pitch. So that was the spark. That was I guess, the moment where we thought, right, that's the model Tackle could use. And that's something that we really could scale up and roll out further.
I am amazed by this and by the sensitivity and creativity of this perception, right? And I feel that different kinds of relationships and flows, exchanges happen between one players playing on the same team, playing together to change, to do something, to especially in sports, and when you have a coach, when you have someone training you, it's a very, very delicate and very specific thing, and can be quite motivating. And I know you mentioned a lot of the process in this, Charlie, but I'm still trying to understand more the details. So,
Yeah.
how are you guys now using football as this tool to talk about uh, critical health issues? Like we're talking about HIV, which is
Mm.
something we have done a lot of progress on. There's, still concerns, still things happening, and other sexual health. And one important thing, in different African communities, right?
Yeah. Yeah. So in a bit more detail, it's about training coaches to be fantastic coaches. So fantastic in a football sense, but not because we really care about the football, but because if your coach is really good, you come back to your session every week and you listen to what they've got to say. So at Tackle, we've always put a lot of effort into helping our coaches become really well qualified, both through our support and local qualifications, but to become really good at that sports part of it as well, because we know that's why the young people come. That's what they're there for. But we also help them become brilliant sexual health educators as well, peer educators, and have those skills. So it's a combination of training up both sides of those skills. And the people who become tackle coaches could be one of those already. They could already be a fantastic football coach or a fantastic peer educator. And we just train up the other side. But really, then it's the structure of football and the structure of sport that gives you such a wonderful platform to talk about an issue because you're training every week or twice a week or more, and you've got matches and you've got tournaments and you've got a whole team dynamic at play in there as well. So sport, and in our case football, because it's so popular and so accessible, particularly where we work, is a wonderful tool to do it. And it is just a tool. It's not the point for us. We're not looking to create great players. We do create great coaches, and they go on and coach for national teams and professional teams in Africa, and that's great. But it's the players who we're trying to really reach through those great coaches, and they'll come back and they'll listen and they'll start to build a relationship with that coach. They'll start to build a rapport. They'll start to ask questions, and that's when you can see the learning start to take place. And also you see very human team dynamics in play where as a group, they might be standoffish at first, but eventually they'll start to warm up to this idea and someone will ask some questions and then the rest of them ask the questions, they talk to each other. So you get a very sort of team cohesion there as well throughout our programs. But it's more than just talking about HIV. We create really interactive, really fun football coaching drills so the players learn about these complicated sexual health issues on the pitch. It's not just come and play football and then chat about sexual health. It's the drills during the session are representing issues to do with sexual health. It could be HIV, it could be contraception, it could be teenage pregnancy, it could be child marriage, it could be a whole range of sexual health issues that are all relevant to the young people we work with. HIV is just one of now like a range of sexual health and reproductive rights related issues they want to talk about. But they're difficult to talk about. We all know that. It's hard to ask these questions. You don't really want to talk to your parents. You can ask your friends, but they don't know the answers really, but they'll tell you something. And we're never going to go to the sexual health clinics and these formal settings. And that's no different from Africa, from when I was growing up in the UK. And it's terrifying to go and do that. So finding a safe place to have those conversations, but where you're getting the right information that can then give you the chance to make choices for yourself and choose how you behave based on having access to the right information and the services as well. So that's one thing we do as well. It's not just education. It's breaking down those barriers so that young people can access HIV testing or HIV treatment or contraception or whatever the sexual health service that they most need, they can access that at a tackle session. or a tackle tournament or a tackle football match. And it's available all the time, and that's another big part of the barrier. So if you don't want to use it this week, it's fine. You can test next week or the week after or whenever you're ready. There's no pressure, there's no timescales. It's all about you as an individual. When you're ready to behave in a certain way or to do those things, then the opportunity is there for you. And we can break those barriers down and help you make those decisions using football as that way to take you on that journey.
And that is so precious, like to have a safe place, to have safe peers to talk to, you know, safe information and breaking down the stigma. So that, again, as I said, the beginning of the interview, this is really amazing. This is something else. Because at first, I think most of us would think, oh, okay, they would just play and chat. But no, it's really intertwined in what you guys are doing. So this is really, really something else. Kudos to you guys.
Thank you. The best drills are you're doing something different in the drill that represents something in the HIV world. So very simple example might be the balls of condom, and you've got to keep it safe. You can't lose. If you lose it, then you're at higher risk of an STI. So your dribbling technique is based on turning away from danger, and that can represent you making decisions in your life outside of football. And so that's a really simple example. But we have hundreds and hundreds of drills that our amazing coaches in Africa create all the time, and they're visual, they're fun, there's learning moments in them, but you can see the young people during the session start to, oh yeah, okay, that means that, and if I do this, okay, I get it, and then it starts the conversation. So it's a really nice way to learn, and so many of us learn by doing. We learn by playing. We don't learn by just being told information. So have it as an interactive learning methodology. It really works.
Patricia, I want to bring your perspective now to this conversation because, well, first, you are in one very specific context, and I think it's important to understand what's going on. And second, you are really in there with the kids, right? With the schools, going to places and pushing the message and the format forward. So I think as trying to break down this question to you, one, what is the context that you guys are facing there in Uganda, right? When we are talking, and was the last bit of the question to you, Charlie, right? You're working in different countries within a huge continent, and that brings a lot of differences, right? So one, what is the context that you see now in Uganda? What's going on? What are your challenges? And then the second part is, how are you guys able to ensure that the programs are culturally relevant or socially relevant and effective across such diverse regions where you operate?
Well, thank you very much, Danielle. We have a number of context challenges in Uganda, for example. Like I said earlier, that I work right now with schools and specifically implementing a menstrual health project. This challenge was raised by our programs during the implementation of the HIV/AIDS program in school. And this came about as a result of the information that we were getting from our players and participants that there was a challenge of lack of information on menstrual health and hygiene management. So we took up this and thought wise to get back to the community with this programming. So that is one of our challenges. And then another one was that there was also lack of information on HIV knowledge. And that is the reason as to why we actually decided to have a program together with the districts to ensure that we raise awareness about stigma related to HIV and reach out to mainly the children and the young girls in these schools. So that is the kind of context that we have. And then there are also issues about child marriages, teenage pregnancies in this context. But right now as TACO, we are dealing with mainly HIV and AIDS in central Uganda, where we work with young people living with HIV/AIDS to manage their mental health. And then also when we come to the western part of Uganda, we are dealing right now with menstrual health and hygiene issues where we are implementing in schools. Now, when we talk about culturally relevant programs, as TACO, we work with the local people. Our coaches are got from these communities where we implement our programs, and also the project officers that implement these programs are got from these communities to ensure that we culturally fit into the diversity in the communities. What we do with the coaches is that we recruit them, and we also train, and then we support them to ensure that they are delivering essential messages to the young people. And the project team is also well trained to ensure that they follow up on these coaches from the communities that they are based, so that they can deliver the messages in the right way. And we're also looking at needs assessment. We don't just go with our programs and fit into these communities. We first find out what is the challenge that this community is facing through our baseline surveys and endline surveys after a project has ended. We also go further to ask them what challenges are faced. So they write these challenges to us. We come back and sit and see how best we can help these people or the young people to manage these problems. That is through our needs assessments. And then we also work with local partners who have already been based in these communities. They have worked with, closely with these communities. We work with them to ensure that we roll out our programs across these regions that we work with, because they better understand these communities well. They have been there for a long time. So we ensure that our partnership with them is very concrete, so that we align with what they already have. So our programs are well and relevant to these communities. We also have M&E. We use our M&E like platform, because TACO, we do not just like implement programs out of the blue, but we use M&E. We use data to inform our programming. So these are our learnings that we take once we are implementing a program. We ensure that M&E is at the heart of it also. This informs our programming and also fitting into the communities that we work with to ensure that these programs are culturally relevant to the communities that we work with.
Thank you for sharing these details. It's always nice to know that many organizations are working with data to, be better informed and share this with the communities they are operating. And I was going to ask you about the connection with local leaders, right, with local coaches, because I understand that this really makes a difference to see the situation, see what goes on. So you brought this to us, and I really appreciate that. And that leads me to the follow-up question, that is about the impacts that you have seen in the work that you do, especially talking about gender equality and women's empowerment in the communities. Maybe from working with this very specific area that you are now, you were able to give us more insight into it. So what is going on? What have you seen change?
Our program have done a lot in the communities. One, it has had a significant implication for gender equality in the communities, and also the women empowerment in these communities that we serve. We realize that it's not just female participation in all the programs that we do, but we are looking at representation and also quality of these female participation in our programs. And we have also created safe spaces. Safe spaces are places or platforms where these girls come together, they discuss issues affecting them, they speak up and also contribute and give ideas. And this has always happened in these safe spaces. So these are some of the things that we are doing as TACO and have realized that are doing well in our programs. And also to ensure that the girls are feeling comfortable, we create these platforms and they gain confidence in like raising out issues that affect them, and also in case they have some decisions to make. These are the platforms that they have a space to speak for themselves. And we are also working together to improve career pathways for our female participants. For example, the coaches in sport. We are implementing a project in the Western region, the Equal Play Effect program. And here we are looking at improving on the quality of the coaches that we work with, because we want them to also be part of sports as a career, as a career to take on in the future. So we have created this environment for the coaches to participate in sports, to ensure that they are participating, but also that they are quality coaches so that they can be taken up in other platforms of sport. Now, when you come to East Africa, where I am based, especially in Hoima district, where we work with female coaches, and these coaches are mainly teachers. We get them from the schools that we work with, and we train them in the drills, that is sport, and then also in the information, either HIV, menstrual health, be it ending teenage pregnancies and child marriages. We train the teachers themselves as coaches. And their involvement in our football guided programs has actually provided them with new skills. And it has also boosted their confidence to even look beyond just being teachers. For example, they have competed for positions that have been previously male dominated. We have now education, the inspectors of schools. We have district education officers. We also have like sports officers as coaches from our programs. And this they have attributed to being part of our programs because they have got that confidence to vie for these positions. We do not only look at the issue of delivering sessions during our programs, but we also encourage them to open up and challenge the note that men are supposed to take up some positions. But given our programs, they have been able to take up these positions. We have our girls who have also competed in the national sports competitions. National, I'm not talking about the districts, but the national level. Atako was also one time like reached out to take up a team to the national level because we work with young girls, and because of our football guided programs, we're able to train a team that represented the city of Hoima in the national level. So you can see that kind of impact that our programs are creating. And our inclusiveness of having health education components that address gender and specific issues such as reproductive health, HIV, and gender-based violence have actually increased women's ability to make decisions that are informed about their sexual health. So these are some of the things that we are realizing from our programs across the continent of Africa.
This is amazing and an absolute great advance, honestly. We had a guest here a couple of weeks ago that said, when we think about empowerment, it's not that we are giving them the power, it's that we are fostering the confidence that they have. And this is absolutely what you guys are doing. It's about giving them opportunity, training them, and giving possibilities that are really come from the power that they already have. So it's absolutely beautiful advancement. Thank you for sharing, Patricia. Charlie, I want to circle back now to something that you mentioned before about finding a model that was possible to scale up. And I feel one thing that is important to us here, this podcast, is to help people see that NGOs, in a level at least, right? If they don't want to think it as a full business, but you guys need to operate as a business, right? You need to fund your programs, you need to understand the business model that you have, and operating in such a large scale. Again, you are taking up on a big challenge on very different places. Brings me to mind some challenges that you might face. So this is a question: how are you able to address the challenges of scaling the programs and still maintaining the quality and impact that was clearly shown from Patricia's input?
Yeah, it's a good question. Obviously, we try hard to do and think a lot about, but the core basis of it is that across Africa, there's a lot of people playing football, and there's a lot of sexual health services out there. So they exist already, and our approach is really to try and combine the two. So the ingredients for scale are already there. The appetite and popularity of football, the young people playing it, they're already there. You don't need to create anything new. Let's just take that information, take those services, and take them to where the young people are. So at a sort of theoretical level, it's all in place already, and we're just trying to mobilize the resource and the partnerships to make that happen on a wider reach and bigger scale. And that's really through partnerships. Football itself is really cheap. It's not a great part of the sort of business approach to tackle, because the cost of a session sometimes it's nothing, right? Like the kids are playing anyway. There's no pitch hire. They're in the community on their local field. The coach could be a volunteer or a teacher in their real job at volunteer in the evenings for tackle. So once you've got some balls and bibs and cones and stuff, like the actual unit cost of a tackle session is very, very low. So as in a development sector, in terms of sort of trying to measure the value for money of a program, a sports-based program, and in our case, a football-based program, scores really highly because it's really cheap, and that helps with the ability to scale it up. So Tackle's approach was never to try and grow tackle. We're just an idea, like it's a concept of how you can use football to support these people with this information. And we've always been looking for other people to scale it, other partnerships, other organizations who maybe already have the structures in their community at a local level or in that region at a national level. So we have evolved more into a training provider. So the example where the piece is working on in Hoima is local districts, education structures, local schools, teachers as the coaches. So that infrastructure already exists. The HIV service providers already exist as well. And we're just joining them up together and using football as that way to connect them. So that's a nice example at a community and district level in Uganda. But we work with ministries of health at national programs in other countries. We work with big NGOs in national programs or multinational programs. So again, we're finding a way to implement this methodology within existing structures to try and keep the cost as low as possible. So it's an effective way. It means we give over control, we give over ownership, but that's fine. That was never the point of Tackle. It was always look, there's a real need for this. There's a lot of young people who are missing out on information and those spaces to talk about it, and they don't access the services. The services are there, the young people are there, they're all playing football. So let's bring them together in a way. So that's been our approach. It's been pretty successful to date. We're operating across West and East and Southern Africa. But there's loads more to do. Like we reach a lot of young people, but there's a lot more who I'm sure would enjoy and value this type of programming. So yeah, more to do.
Let's talk about what's more to do then. And in this, I'm going to split here because I think we can have a more overview perspective or what is lying ahead. What are your plans for the future, Charlie? And then, Patricia, after you could join us in this and tell us what are your perception of the future? What is your vision for the future? Shall we? So first with you, Charlie.
Well, yeah, like I said, there's more to do, and we're always trying to think of ways to do it and find the right partnerships and ways to resource that program or those programs. So Tackle has evolved quite a lot since the original days in Uganda. Most of our work is still prevention work around sexual health, working with adolescents in that sort of 10 to 18 bracket. You're just growing up, you're starting to become sexually active, you're starting to think about these issues, and we want to try and reach you at that point in your life rather than a bit later on when those behaviors are perhaps already established in your life. So most of our work is still in that space, and it will continue to be, and there's loads more to do. But we've also adapted the model to work in other spaces. So we have a very successful program in prisons in Southern Africa, working with slightly older groups, working in a very difficult environment, but really high HIV needs, very high infection rates, very low knowledge levels, but also difficult structures to work within. So that was a really interesting new recent development in recent years for Tackle. We work with injecting drug users in coastal Kenya. We've worked with LGBT groups in different parts of different countries as well. So we are always trying to see how the model can be adapted to reach different people, different types of people who also have sexual health questions as well. So that's definitely something for the future. As well as that, I think hopefully like the end game is those that work with the ministries where we work on, the value is understood at that level and they mainstream these programs. The Hoima example is a great one, and that is an existing Ugandan government structures running these programs with a little bit of support from us. After a few years of that, they don't need our support. They can do it themselves, and they can roll it out across other districts as well. So that mainstreaming of the methodology to reach many more people, and we'll stay involved if they like. We'll help with drills, or well, I won't, but Peace could. But you know, it's all locally led and locally driven. So we're trying to create that sort of groundswell of evidence and interest and demand, and see it be picked up that way.
Now to you, Patricia, what is your perception? What is your plan?
Yes, Charlie spoke about partnerships, and that is also a part that I would say, and that we are looking forward to building stronger partnerships with local organizations around areas that we work in different regions. We're also looking at creating that collaboration with the schools and community leaders to ensure that our programs are culturally essential and relevant and supported at the grassroots level. And another thing that I would maybe look forward to is to have an inclusive programming where we can develop tailored programs that address the specific needs of these diverse groups that we work with. For example, the marginalized groups in communities, differently abled individuals, and also those that are from various socio-economic programs or backgrounds. Last week, we were talking about how we can bring an aspect of economic into our model of using a football to reach out to especially the women, because the people that we work with are now growing, the girls that we work with are growing, and their need may not be the information, but economic. They need money to support them. So we are also looking at that aspect of how we can involve an economic aspect into our football drills or into our programming to ensure that our participants are supported. So this is something that we are looking forward to. And of recent in Kampala, we actually enrolled a group of young people with a hearing impairment. They are also part of our program participants. So this is something that we are also looking towards to targeting more of such categories of people. If possible, also bring the visually impaired. So these are our visions that we are trying to ensure that come the future, we'll be able to meet.
Oh, I'm pretty sure you're gonna meet. And I'm talking to the listeners now to tell them we, as usual, covered some ground here. We talked about some of the aspects, but you can have more information about the beautiful, beautiful work that they're doing to their website. So you can check tackleafrica.org. I'm going to add the link here in the description of the episode, and then you can understand better what they're doing, the places that they're working on. And this leads me to my next question to, again, both of you. If anyone listening or watching us got interested, want to engage with you guys, what would be the best ways to help you keep moving forward and achieve those visions that we have just discussed?
Well, I think lots of ways, and thanks for the opportunity to talk about. I think join in. Like, if you're interested in what we do, if you're passionate about football or about these social issues, get involved and become part of the movement that is Tackle. So if you are on social media, get involved in the conversation, chat to us, talk to us about the issues in your area. We'd love to engage more with you there. If you're in the countries where we work, join in, right? Become a coach, or help us out with our delivery of our programs in those areas. There's loads of opportunities on that side. If you're listening in the UK or France or Germany, join our events, like help us raise some money to do more of this work. So we have loads of football marathon events and football tournaments, and we love that idea of raising money through football with football fans, and then using football as the way to create social change where we work as well. So come, check out our social media, check out our website, get involved with the events, help us do more of this work. But you can also talk about these issues as well, right? Raise awareness of not just Tackle, but sexual health issues across the world. Like, it's going to be an issue where you live as well. Maybe not talked about as much, maybe not HIV, but certainly sexual health affects all of us. So talk about those issues. Let's create an environment where it's easier to talk about these things. They're not taboo, they're not to be embarrassed about, they affect all of us. Yeah, be brave amongst your social network and ask some of these questions, because it affects all of us, particularly the next generation coming through. So yeah, we think lots you can do. Or if you like, you can donate. And I'm sure we can put a link here somewhere for you to click on as well and help out. And then that helps us raise more money to deliver the programs that Peace has been talking about in Hoima and across Uganda and across the rest of the countries we work in.
Perfect. And now, Patricia, what would be most meaningful to you there in Uganda? Do you have anything specific that you'd like to request right now?
Well, thank you so much, Danielle. Charlie has mentioned all this. Please, if you want to come and be part of us, come volunteer with us. Come, let's reach out to these schools down on ground. We have programs across the continent. You can go to Kenya, you can come to Uganda. We have Zambia and everywhere. Just reach out onto our website and you get to learn more on how you can you can be supportive. Yes, Charlie mentioned about advocacy. Come, let's shout about these issues that are affecting the young people in our continent and also our countries that we work with, and down to the grassroots. Come, shout, participate in our events, donate whatever small amount you have, please. We welcome it. It's not small, but it will create an impact in the communities that we work with and touch lives of the young people. Thank you very much, Danielle.
Thank you, Patricia, and thank you, Charlie, so much
Thanks,
for
Danielle.
joining us today. This was a wonderful conversation. I loved learning more about what you guys are doing. Thank you.
Thank you very much for having us.
Thank you.
And to everyone else listening or watching us right now on YouTube, thank you for staying for one more episode. And remember, if you liked it, press subscribe. But more importantly, share with your friends, share with your family. Maybe you know someone that could profit from this conversation, that would love to learn more about this as well, and maybe join the cause, right? We never know. We never know what will touch people's heart. So if you know someone, share this message, because this helps us spread the word about the importance of the work that Tackle is doing in Africa. Again, check the link of their page, donate, volunteer, advocate for this. Let's talk more about it and create more safer space. All right? Bye, and I see you in the next episode.
Thanks. Bye.